Okay, let's talk about something that can be, well, terrifying. Seeing blood when you're pregnant. Your mind can instantly go to the worst possible place, right? But here's the thing, it doesn't always mean something is wrong. So in this explainer, we're going to break it all down, piece by piece, trimester by trimester, so you can get a clearer picture of what might actually be going on. So what does it actually mean when you see blood during pregnancy? Honestly, it could be anything from a totally normal part of the process to a serious warning sign that you need to act on fast. And a huge clue to figuring it out is when it's happening. We're going to walk through this together in order from the very beginning of pregnancy right through to the end. All right, let's dive in. We're going to start right at the beginning, in early pregnancy. This first section is all about the common and thankfully less concerning reasons you might see a little bit of blood. So first on our list is something called implantation bleeding. The big thing to remember here is the timing. This happens super early on, like 6 to 12 days after fertilization. A lot of times this is happening before you've even had a positive pregnancy test. It's kind of like planting a seed in a garden. As that tiny little embryo snuggles in and embeds itself into the wall of your uterus, that little bit of, well, burrowing can cause a little bit of spotting. But wait, how do you tell this apart from, just getting your period? It's a great question because a lot of people get them confused. The key differences are in the flow and the color. Implantation bleeding is usually really light. We're talking spotting, not a real flow. And the color is often more pinkish or even brownish, not the bright red you'd associate with a period. Plus, it shows up a bit earlier than you'd be expecting your period to start. Okay, another really common reason for a bit of spotting is cervical irritation. See, when you're pregnant, your body sends a ton of extra blood flow down to your cervix. This makes it way more sensitive than usual. So things that are normally no big deal, like having sex, or even just getting a regular pelvic exam from your doctor, can sometimes cause it to get a little irritated and bleed a tiny bit. It can definitely be alarming to see, but a lot of the time, it's just a normal side effect of all the changes happening in your body. Okay, so we've talked about the more common, less scary stuff. Now we have to shift gears and talk about the more serious reasons for bleeding in early pregnancy. And it's really, really important to understand these because these are the signs that mean you need to get on the phone with your doctor like right away. So this one has a complicated sounding name, a subchorionic hematoma. But don't let the name scare you. All it really means is that a little pocket of blood has collected between the wall of your uterus and the membrane surrounding the baby. You might only see some light spotting, but this is definitely something a doctor needs to know about. They'll want to keep an eye on it with an ultrasound to make sure everything is okay and the pregnancy is moving along safely. And now we have to talk about the one that is, of course, everyone's biggest fear, miscarriage. This is the loss of a pregnancy, and it's usually linked with much, much heavier bleeding, almost always with cramping too. The rule here is simple and non-negotiable. If you are experiencing heavy bleeding, you need to go to an emergency room. Don't wait. It really is that serious. There's another really critical condition called an ectopic pregnancy. What happens here is that the fertilized egg doesn't make it all the way to the uterus. Instead, it implants somewhere else, and most of the time, that's in one of the fallopian tubes. And that's a huge problem, because a fallopian tube isn't designed to stretch and grow like a uterus can. It just can't support a pregnancy. And that's exactly what makes it so, so dangerous. An ectopic pregnancy is a true medical emergency. It's life-threatening. If it's not caught, the fallopian tube can actually rupture, which causes massive internal bleeding. The classic warning signs are bleeding plus a sharp, severe pain, usually focused on just one side of your abdomen. If you have those symptoms, you don't call, you just go. Go to a hospital immediately. And this quote just says it all perfectly. It's so easy to panic and dive into the rabbit hole of the internet trying to figure out what's going on. But honestly, it's the worst thing you could possibly do. There is nothing like the peace of mind you get when a real doctor looks at you and says, hey, it's nothing to worry about. And on the flip side, if it is something serious, well, then you're already in the exact right place to get the help you need. Okay, let's fast forward a bit. We're moving on to later in the pregnancy, the second and third trimesters. Bleeding at this stage usually happens for completely different reasons than in those first few months. And just like the serious stuff early on, these conditions also mean you need to get medical help right away. So first up, we have something called placenta previa. Just picture the cervix as the exit door from the womb. With placenta previa, the placenta, which is basically the baby's life support system, has attached itself too low in the uterus, and it's either partially or completely blocking that door. The big sign here is often sudden, bright red bleeding, but with no pain.
This is a big deal. It needs to be monitored very closely, and it almost always means the baby will need to be delivered by a C-section.
Next is another emergency situation called placental abruption. This is when the placenta actually starts to tear away from the wall of the uterus before delivery. And this is incredibly dangerous because it can cut off the baby's entire supply of oxygen and nutrients. Now, unlike placenta previa, this one usually comes with a lot of pain, intense contractions, and your stomach might feel really hard or firm. This is a 5-alarm fire. It requires immediate emergency medical help.
But look, not all bleeding late in pregnancy is a sign of an emergency. Right at the very end, as you're getting close to your due date, you might experience something called the bloody show. It's just what it sounds like, a mix of mucus and a bit of blood that comes out as your cervix starts to thin out and open up for labor. And this is actually a good sign. It's your body's way of saying, get ready, this baby is on the way.
Wow, okay. We have covered a lot of ground here, right? Everything from totally harmless spotting to some really serious emergencies. And that brings us to the final, and honestly, the most important part of this whole thing. What on earth do you do with all this information? And here it is, the single most crucial point of all. After hearing about all these different possibilities, I hope one thing is crystal clear. Sitting at home, you really can't tell which is which. You just can't. That little bit of spotting, is it just some harmless irritation, or is it the very first sign of something serious like a subchorionic hematoma? The truth is, there's no way for you to know for sure. So what's the one and only safe thing to do? It's a really simple 3-step plan. Step 1, you notice any amount of bleeding. I don't care if it's one spot. Step 2, you fight that powerful urge to wait and see, or to go looking for answers on the internet. And step 3, you pick up the phone and call your doctor or your midwife right then and there. Let them be the detectives. Let the professionals figure it out. It is the only way to guarantee the safest outcome for you and your baby. And that really brings us to the big takeaway here. We've gone through this whole spectrum of possibilities, from no big deal to get to the hospital now. But it all boils down to one simple, powerful action. The point of knowing all this stuff isn't so you can diagnose yourself. No way. It's so you understand just how important it is to make that phone call. So what's the one action that will always ensure the safest outcome for you and your pregnancy? It's reaching out for professional medical help. Every single time.